guess who we have in the studio with us today? Ann Montgomery, our senior healthcare expert. How are you?
I'm good. Thank you for having me.
All right, we're here to discuss a serious subject, though, and that is Medicaid work requirements. This week, Nebraska will become the first state in the union, Ann, to implement stringent Medicaid work requirements under Trump's big, ugly bill, which passed in 2025, and other states will soon be following suit. Now, I want to start with the fact that Medicaid was never intended to be a work-related program. You never were supposed to have to prove that you're working to get health coverage. Is that right?
That's absolutely correct. And it really doesn't help to link Medicaid and healthcare coverage to a punitive requirement to work. It's great to work. I love working. I love working at the National Committee.
Sure.
But to make it a punitive, if you don't work, then you don't get healthcare coverage and you get sick and so on. This is not going to turn out well. And everybody knows that.
70% of people on Medicaid already work or are in school.
That's correct, yes.
So why don't Medicaid work requirements work? Why are they unproductive? Why are they unfair? Why are they unnecessary?
They really haven't worked in Arkansas. That was the first state to experiment with them, and I think it was 2018, 2019 when Arkansas tried this. And the result was that 18,000 fewer people ended up, on Medicaid.
Right, they just lost their coverage.
Right, uncompensated care rose. So it's pretty obvious, like I say, that when you are sick and you need health care, whether or not you're working, you've got to have access to it. So it simply doesn't make sense to tie work requirements to Medicaid.
And who do these Medicaid work requirements hurt the most, Ann?
I think they hurt many, many people. They will certainly hurt older people. Fortunately, Medicare beneficiaries, including those who are low-income dual eligibles, eligible for Medicaid and Medicare, are not going to be affected. So that's good news for, many in our membership. But those who are near elderly or older workers, 50 to 64, have never been subject to any kind of work requirement, before. They're going to struggle, particularly because that is an age group that tends to find they're being laid off. They're thought to be a bit behind. They're thought to be, crowding out younger people who are trying to enter the workforce.
Or they've been doing backbreaking work for so many decades that they need to stop.
That's right.
Doing backbreaking work.
Exactly, and there's ageism, very much a part of our society, which we hope to get rid of someday.
So where are all these jobs that older Medicaid beneficiaries are supposed to suddenly get?
Exactly. And the economy overall is as we know, not doing particularly
great.
well. Affordability is an issue. The healthcare sector is going to shrink, not grow. And many other sectors, there's concern that they will shrink as well. We have AI coming on. That's going to be transformative for many in the job sector. So this is a very challenging time to be tying healthcare coverage of the most basic sort. You get sick, you get hit by a car, whatever it is, to your ability to work.
And it's not just whether you're working or not. It's the ability to prove that you're working in this new system of red tape.
Yes.
Where you may have to recertify that you're working every 6 months or you're going to lose your benefits. And we know what government red tape can be like. And we know what it's like under this administration.
That's right.
That's made it harder for everyday people to do business with the government. So isn't that part of the problem? Just proving that you're working if you are.
Yes. The bureaucracy of having to report that you're working and how you have to report is going to be challenging. There's going to be a final sort of decree from the federal government expected in June. That will set out the rules that states will need to follow. And then it will be a 6-month scramble, since this all takes effect in January 2027, for states to put in place the way that they're going to screen people, how they count hours. You have to have 80 hours a month of work.
Even though Nebraska went ahead and jumped the gun and passed their ruals anyway.
Yes, they did. They did.
This week.
And
they didn't wait.
Right, and so maybe
I can't wait to put those work requirements.
They may have, Nebraska may be a state that has its house in order a little bit quicker than other states.
Unfortunately, in this regard.
Yes,
So,
but I think it's going to be rough for states to get their systems in order. And I also want to mention very quickly that it's not only Medicaid healthcare coverage that is at stake here with regard to having to work. It's also SNAP or food assistance, nutrition assistance that really comes, with the Farm Bill, with USDA. That is also conditioned on work, and the rules are going to be similar but not exactly the same. So will states struggle to see what the work requirements are for SNAP as they are, and whether they're the same for Medicaid? Yes, they are going to struggle. It's not going to be easy.
good question. And just to remind everybody, the big ugly bill that Trump and the Republicans passed in 2025 cut $1 trillion from Medicaid and SNAP. So this seems to us like a way of punishing poor people or lower income people just for being lower income and not born on third base, as they say, while we're showering billionaires with favors.
Could not agree more. This is not a great development, for the United States of America. I hope it can be mitigated. I hope it can be possibly reversed. We shall see. But for the next several years, it's going to be rough, and we're going to see a lot of contraction. We're going to see a lot of pain. In 2026 alone, the projections are that we'll see 1 million fewer insured.
Yeah.
And then it'll jump to about 5 million. Then it'll ultimately jump to 10 million if we do nothing.
10 million people deprived of health coverage for no good reason, other than that they wanted to pay, that Trump and the Republicans wanted to pay for more huge tax breaks for the already wealthy.
Yes.
I mean, how else can you put it? That doesn't sound like American values to me, or what we always considered to be American values.
Fairly twisted values, I would say,
Yeah.
and I hope we can make a difference. And here at the National Committee, we're going to be out there urging that we change this.
All right, and anytime you interact with your member of Congress, please let them know Medicaid work requirements, no good. Okay, thanks, Ann.
Thank you.
Good talk. We'll see you next time.